Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. This is a weekly podcast. Thank you for listening. We are here with Dr. Sara Figueredo. She is the Technical and Research Director of the Institute. How are you, Doctor?
I'm very well, Louise. How are you?
I'm doing great.
Great.
So we do have an interesting topic today, as always, how the stem cells can help for liver disease. What can you tell us about the properties of the stem cells helping patients with liver disease?
Okay, so basically, again, as we know, as many of our listeners know, the stem cells are regenerative. So what that means is that they can go in and regenerate damaged tissues. In this case, the liver. The liver itself is an organ that can, to some degree, regenerate itself. And it can reverse damage even on its own if given the right opportunities and in the right situation. So what the stem cells do is they go in and help the liver regenerate the damaged tissues that may have been damaged from many different causes. And I know you're probably going to ask me, how can liver disease come about? Right? Is that correct, Louise?
Yeah, I remember you mentioned once that because of our diet down here in the Latin American countries, it was we were propense to have liver disease. Is that correct?
Yes. So cirrhosis of the liver, there are two types. There's alcoholic cirrhosis and non-alcoholic cirrhosis of the liver. And what that means is basically it's a fatty liver, and it compromises the function of the liver, and it causes inflammation. And so the alcoholic cirrhosis of the liver is self-explanatory. It's with the high intake of alcohol. With non-alcoholic, now what causes non-alcoholic cirrhosis of the liver? Certain medications can do that, but specifically in our diet, something that we can really control is eating things like corn and peanuts. Those two are very, very high in a fungus called aflatoxin. And even if the peanuts and corn or maize is organic, we can't get away with the aflatoxin in very high quantities of it in corn and peanut commodities. So we want to try to minimize, if not to eliminate, corn and peanut products in our diet. And I know so many of our listeners love peanut butter. They love their Doritos.
Oh,
Here in
we love tortillas.
That's right. Here in the Latin American countries, yes, it's a staple. Tortillas, tamales, the snack foods that are made with
Corn
corn,
chips, yes.
exactly, corn chips, tortilla chips. And so it's a staple. So it's really hard for a lot of Latin Americans to be away with that type of with corn. But yeah, unfortunately, there is a high prevalence of non-alcoholic cirrhosis here in Latin America because of that very fact. And so so that's one big cause of non-alcoholic cirrhosis.
So the stem cells do have some anti-inflammatory properties that will help.
Yes, that's right. That's right. That's only one. It's one of the biggest effects of stem cells on any tissue is, and in the whole body as a whole system, is the anti-inflammatory effects, that the decrease in C-reactive proteins, decrease in erythrocyte sedimentation rate. If we're looking at blood work, we can see all these things very objectively. We can measure them, and so in the case of liver disease and basically any other disease or condition where there's high inflammation with stem cells, we definitely see a reduction in the inflammatory markers.
Okay, in this case, to treat liver disease, what are the stem cell treatment options? I mean, what type of stem cells would you use?
So in this case, we would use stem cells taken from the bone marrow with our proprietary expansion and harvesting and our cocktails that we use, that we can generate brand new non-toxic stem cells in the hundreds of millions, which is so important. And we apply the stem cells in the portal circulation, which is directly into the liver circulation. And so we would use bone marrow in depending on whether we may even combine them with endometrial stem cells, depending on whether there's any kind of a liver damage caused by autoimmune conditions, which endometrial stem cells address very, very well. And so we would most likely use a combination of those two, or at least the bone marrow. Again, depending on the primary cause.
This is also called hepatitis C. Is that correct?
That's right. So hepatitis, which are all hepatitis A, B, C, which are all liver diseases, then can cause inflammation of the liver and so on. The stem cells can absolutely address the liver damage caused by hepatitis as well.
Okay. After the treatment, what my future will look like? In case,
That's a good question.
yeah.
Yes, yes. So, we see a decrease in inflammation for sure, increase in liver function. So we do all of the objective tests. We do liver enzymes, all the liver panel, liver function tests, and then after some time, we would see liver enzymes decrease. We would see inflammation decrease. We would see an overall increase in functionality of the liver. And so we would also see, decrease in any kind of pain that may have been caused, any kind of jaundice type situations where it's a yellowing of the skin,
I was just going to ask you that.
digestion.
Yeah, because the skin
Mhm.
totally changes when you have hepatitis.
That's right. That's right. Because the liver just can't clear out, it's just not capable of clearing out toxins.
Toxins.
So right. And the kidney is one organ that clears out water soluble toxins, and that's what we urinate out. In the case of the liver is always working to eliminate fat soluble toxins. And when those aren't being eliminated, they accumulate and make our body really toxic. But in both cases, our body can get very toxic if we can't eliminate them well, if the kidney isn't working well, if the liver isn't working well. So, and the liver is directly linked to the digestive tract. So we see digestion improving, bowel movement. Bowel movements improving, and better elimination because of the liver functioning better.
And after the stem cells are applied, doctor, how long does it take for the stem cells to do their work?
Okay, so the general rule of thumb is about 3 months. 3 months to see some kind of change.
Okay.
We have seen patients feel better within weeks or days. In other cases, yes, we will need that time for regeneration takes time. We damage doesn't happen overnight. It can take over time, and whatever the cause might be, it can take time for a condition to get to a point to where you see a change in the function and you feel different. And so regeneration and real regeneration of cells and tissues and organs takes time. And so we usually say general rule of thumb is 3 months to see some kind of change. And that could be just the beginning of the change. And then it can continue from there.
And I believe you do the whole preparation, like the environment for these stem cells to do their job. And
Right.
mhm.
Right. So the internal milieu, that's right. That's the environment we're talking
Okay.
about in the body. Yes. So all of the preparation, all of the pre-treatment protocol, as I've mentioned in our past podcast, but I will absolutely mention them here for new listeners. So our very, very comprehensive treatment includes a total body detoxification program, which involves a nutritional IV of B vitamins, vitamin C, minerals, and antioxidants, and it's just a potent little IV that helps start the detoxification process in the liver and the body. And then we follow that up with 4 nights of an organic coffee suppository with antioxidants as well, and B vitamin shots. And then we do that in tandem with age appropriate growth hormone therapy, which again is preparing the body and almost rejuvenating it to the point that it will receive. It'll create great stem cells and receive the stem cells in the best possible environment, along with oxygen therapy, which we'll do in the form of either hyperbaric oxygen therapy or exercise with oxygen therapy, depending on the patient's limitations. And again, these are all things that are, oxygen is life giving, and it's again sort of rejuvenating, preparing the body and the stem cells. And then lastly, we will include a stem cell enhancement formula, which is a really nice blend of, and it's very personalized blend of herbs and minerals, again, to keep the stem cells just humming. And all of this usually we continue after the patient goes home. We continue it for up to 3 months. And we only have the patient in Guatemala for 7 to 10 days, depending on what we're treating.
Do we do the follow up after they leave Guatemala, doctor?
Oh, yeah, absolutely, Luis. Thank you for mentioning that. Yep, we sure do. We will follow up every couple of weeks, and it's a matter of just tracking their progress and making little tweaks if we have to, in certain things, and yeah, basically tracking progress is really important for us.
Yeah, the reason why I asked you that last question was because I can hear some testimonials of your patients that you were always doing the follow up, and that's very important for any patient suffering any disease that the person that we go usually go to is taking care of us, and they call and they are checking up on us. So that's very important, and I know you do that, so that's why I ask you that question.
Thank you, Louise. Yes, that's really important for me. Yeah, I don't like to just treat a patient and say, okay, goodbye, good luck.
Yeah.
Hope everything works out for you. So I feel very
Imagine if that is important for you, how important it is for your patients. I mean,
for the
it's
patient.
yeah,
Exactly.
it's something that
Exactly.
no, like you said, no one does, and I know you do it. So,
Thank you.
doctor, anything else you would like to add to this podcast?
No, I think we've covered a lot of ground. I guess we should mention that, yes, the treatment takes place in Guatemala because it's just not available in North America, legally. And we have the patients come down for 7 to 10 days. So we provide, with the treatment, we provide accommodations as well as a personal driver. And, uh, and we make arrangements for any kind of local tours and excursions if necessary, which I would highly recommend. And yeah, and I'm sure, Louise, I'm sure you'll follow up with contact information.
For sure. Yeah, at the end of this podcast, you will find all the information how to contact Dr. Figueredo. In case you have any questions, we will deliver those questions directly to the doctor. So, doctor, I appreciate your time and thank you for sharing with us your knowledge. Um,
Well,
you,
it's
t-
always a pleasure, Louise. It's always a pleasure. Thank you.
you take care. Bye bye.
Thank you. You too. Bye bye.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo, that is on YouTube. Thank you.